Good afternoon. मैं डॉक्टर शिप्रा सिंघी MD ophthalmology from AIMS Delhi. I'm using this Optopol OCT machine since 4 to 5 months, and diagnosis and treatment wise, it is awesome machine for me and as well as patients. So we can start from the optic neuritis. That you can see that here is a spike. Here's a spike of the disc edema. So this is a typical case of left optic neuritis. You can see here from this photo. So blurring of the disc margin compared to right eye. So another case of macular hole. We can see here. This is the case of macular hole. And now in the retina, it is like this. So this is the typical case of macular hole. This is the patient of the CKD and hypertension. So what we got on the scanning, there were papilledema grade 4. So you can see here spikes, and there are the absent spikes due to much higher spikes. These are not visible here because you can see there is a grade 4 disc edema. And in frontis picture, you can see here disc hemorrhages. Here is a macular star and grade 4 papilledema. So other eye of this patient, again disc hemorrhages, disc edema and macular stars formation is there. This is a typical case of macular edema, diabetic macular edema. We can see here small spaces. These are spongiform diabetic macular edema. According to this type of macular edema, we can treat also this. So for the classification purpose, OCT is very useful. This is the case of CNVM. So you can see here, this is the classical picture of the CNVM. Choreo neovascular formation is here. This is old scar and this is the formation CNVM left eye. Again, it is a typical picture of accelerated hypertensive retinopathy. So again, there is a grade 4 papilledema, and we can see here there is a macular star formation and the soft exudate, hard exudate, disc hemorrhages and disc edema. You can see here grade 4 papilledema, soft exudates, retinal hemorrhages and macular star. Typical picture of accelerated hypertensive retinopathy grade 4. So you can see here also typical POAG cases. These are the cupping and the graph is running around the red area. And this is the case of typical PACG. In one eye, the patient had cupping of near total cupping. So you can see here the margins, and here the cup is small, but here there is almost gone, near total cupping. And when we did the angle OCT, This is the picture of that patient. It is an angle almost 23-21. So it is a case of typical PACG. And again, we going to the Fuchs dystrophy. There is a typical picture of Fuchs dystrophy and corneal edema. So pre-VEGF CNVM and post-VEGF CNVM. It is also useful in the assessment of the treatment and progression. Again, we can see optic neuritis. Here is a absolutely normal fundus, and here there is a spike of the neuritis. So basically, I want to say that this OCT is very sensitive and very useful for the doctors as well as the patients, and it is hardly consumes time. So in few minutes we can take proper scans, and we can treat the patients. Thank you.